Huples Cat and...
Kitty cat.
So today, the 11th of January, is vaccination day for Kitty, and she's just come back and she's going to tell us all what it's like to have the Pfizer vaccine for the first time.
Well, it was fine. Yeah, it was very well organized where I had it done. Flowed right through, waited 15 minutes afterwards. Didn't hurt. Doesn't hurt now. Don't feel sick. Feel good. Glad to have it the first shot done.
Good. Hopefully you won't die, because my subscribers might lose faith in the vaccine.
Hopefully I won't die. I don't feel like I'm about to die. In fact, I feel hungry.
Oh.
And a little tired because I had to get up early after nights to go in and get it done, but I'm happy to get it done. And I'm very happy to see my Wolfie and spend the evening at home with him. Hey, Wolf? Yeah, you're not dying either, are you? No, you're full of zest.
Kitty works nights all the time as an ICU nurse in a level 3 trauma centre in downtown Toronto in Ontario, which is in Canada. And she also does rapid response, and she actually occasionally floats to the COVID ICUs, but she actually goes to the floors and deals with COVID patients on a regular basis. So she's one of the first people in my hospital to get vaccinated, though some of the day people have been getting it, because they actually are only allowing it to be gone Monday through Fridays and sometimes on weekends between business hours. So for those of us that work 7 p.m. to 7 a.m, this is a major pain. So we just finished 3 nights, 3 12-hour nights, which you don't finish, you know, you get there before 7 and you leave about 8. So Kitty actually is going to tell us what happened in terms of how she booked the appointment and what happened and some of the tricks and things she learned whilst doing it in terms of using it online to speed up the process. Don't look startled, Kitty.
Not sure what I learned.
So, Kitty, you've just finished nights this morning and we got home at about 8:30.
Mm-hmm.
Right. So what time did you have to go for your appointment?
3:30.
Okay.
Well, I mean, because I couldn't, they don't have a system you can book it from home, so I had to wait till I went to work to book it. And the sort of early morning pre-shift appointments were already taken, so I wanted to get it done. So I got up early and drove back to the hospital and got it done.
Right.
Which they are actually extending hours, so you could get a shot at 7 if you're working a night shift that starts at 7:30 or 6:30. They do have those now, but they were already full, so I couldn't get one of those. And I'm not working tonight, so I didn't really want to go later. I thought I'd just get it done. And they automatically book you 3 weeks later for your next shot. So in 3 weeks, I'll go and have my second one.
So Kitty had it booked via our hospital, and that's how it's being done. It's not really being done provincially, which is kind of odd. It would be a lot better obviously for us to go to Newmarket and people that live in Toronto to go to Toronto, but that's not how they're doing it. So Kitty actually had to do a consent form and a few other things, but she did them online before she went.
True enough, I did, yes. And
so what did they ask you?
They asked if you had any symptoms of COVID right now. They asked if you had any reaction to vaccines in the past. They asked if you were allergic to the polyethylene glycol. And they asked, that was about it.
Oh.
If you had autoimmune disorders, if you had blood, bleeding issues. Those are sort of typical to any sort of vaccine. If you'd had a vaccine for something else in the last 2 weeks.
In the last 2 weeks?
Yeah, they asked you that.
And they would say no at that point, right?
I presume they would say no. They'd ask if you're pregnant, which I chuckled over. Or breastfeeding.
Well, you're kind of breastfeeding, Wolfie.
Yeah. Or if you thought you had an exposure to someone with COVID, unprotected exposure.
So one of the things that you'll see online is a lot of people say that when they have the first dose of the vaccine, they get like euphoric and really happy. So I was kind of interested to see if Kitty would have that experience or whether that's just kind of hype.
Well, I think if you did, it would probably be just relief that you're starting on the road to getting some immunity. I don't feel euphoric.
Right.
But then I am just coming off nights. I'm glad to have it done.
Kitty, did you have any concerns having the vaccine given the fact they're full of nanoparticles and Bill Gates has designed it to wipe out most of the population of America?
No, I do not. I think that we're already all being tracked through our phones.
Well, you're not. Well, you're not. You never use it. You don't have a data plan.
Why bother injecting us all when they can just placate us with a toy that we all carry around and they can track us that way? If you're really worried about it, don't have a phone. Don't have a credit card.
They have to have some sort of a massive supercomputer to track all
Almost everyone has a phone.
So in the United States, there's reports of up to 40% of nurses in hospitals in heavy COVID areas are actually declining the vaccination. So I was wondering what you think about that. How happy would you be if 40% of the staff in 6 months haven't had the vaccine that you're working with? And how likely do you think that is in Toronto? And what do you estimate as a guess the refusal to be vaccinated rates will be? And do you think, there is no plans at the moment, but do you think there will be a price to be paid for people that decide not to be vaccinated who work with COVID patients in ICUs?
No one I've spoken to directly is planning not to have it. So in my limited empirical place of work, I think most everyone is going to get vaccinated. That doesn't mean that there's not a small percentage that won't. People in the general public, I've heard more concerns and consternations about just miscellaneous people. When I say I'm getting the vaccine, they say, "Oh, I wouldn't put that in my arm." So I think there is. It's hard for me to guess prevalence. There's certainly a minority of people that are going to refuse it. I think that there will be and probably should be restrictions. Right now, if you don't vaccinate your children, there are restrictions on them in school settings. I think international travel, if you haven't been vaccinated in the near future, should probably be kiboshed. You should have to prove that you've been vaccinated to do certain things. That way it's not mandatory, but the social pressure is there. I don't think they want to make the vaccinations mandatory, but obviously if the majority of people don't have it, it's not going to provide herd immunity.
They're definitely not making it mandatory.
No, they're not.
However, with the flu vaccine at work, we have to fill in an online form declining it, and I do that every year, and you don't for various reasons. But what I'm wondering is 6 months after the peak of COVID's disappeared, like say maybe a year from now, when austerity kicks in because everybody spent far too much money, all the governments have, and all the provinces have, I can foresee them being terminated. What do you think about that? Do you think that's possible? Like right now, no chance because we just want anybody we can get, no matter what, right? But if there's like, say, 2%,
No, I don't think that will happen.
You don't think they'd be terminated? Would they be allowed to go into the hospital, given there'll still be outbreaks around the world for years to come?
Yeah, I think they will.
Okay. You're optimistic on that one.
I am. I think it'll be a small minority, and they may be required to wear masks when not masking is the norm again. You know, like flu vaccine.
That would be very ironic.
It would be that anti-vaxxers would be wearing masks. They do that with people who don't get flu vaccines. Right. But I mean, we're union protected. I think that there would be an outcry against mass firings of people who are not vaccinated.
Depends how many people die over the next 6 months.
Yeah, I don't tend to think that will happen, but I mean, how do I know? We've never lived through this before. Right. I don't know. No one's been fired for not getting the flu vaccine. That is not the same thing. I know that. I'm hoping that the actual number in healthcare is small of people who won't. I've heard that in long-term care that there is some resistance to vaccinations. I like to think that's because it's perhaps a different breed of nurse in long-term care. We are working in a high-tech environment where we, place our faith in drugs all the time.
Well, it's very hard to decline a vaccine for a disease process that you're seeing multiple times a day that absolutely kills people.
For sure. So, I have heard there are some nurses in places in the hospital that are, reluctant. Yeah. Nobody wants to get an injection and to know they might feel achy for a few days. And it's not, it's not fun to go and get an IM injection, but I think most people want to be able to see their family and to see their parents and to stop being afraid when they're looking after patients that have this virus. Yeah. We're having more staff going into quarantine because of exposures. We're having more patients convert on the floors, so that patients that have been in the hospital for a year that are sort of chronic, that we see that might have trachs that we have to assist that are negative, or that have no known reason to be positive, and then when they've spike fevers we test them and they are, it wipes out a whole bunch of staff that have not been in full precautions and therefore at risk, so they have to be gone for 2 weeks essentially, and some of our services have limited numbers of staff to begin with. Our respiratory therapists, our rapid response team, they have 6 respiratory therapists out right now in quarantine in a fairly small pool of people. We have 3 rapid response nurses out because of an exposure to someone who converted to positive on the floors, and we just can't have that. Not to mention some of these workers are part-time. If you don't work, you don't get paid. I think there is a government benefit they could apply for, but that's more bureaucratically difficult. So nobody wants to be forced off for 2 weeks at this point.
So as it stands, my department's still arguing about if and when we're going to get vaccinated. So there is a plan, and we're not included in the plan. There's 2 or 3 parts of the groups in the plan that we actually fit with. So there's some argument going on right now. There's only 6 people in my department, and what we do is on nights and weekends and statutory holidays, we're the only manager in the entire campus. So we're constantly going to different areas of the hospital, including COVID areas. We're not physically nursing COVID, but we are very close often to families and patients and staff. And if somebody is converted and has to go home, it's us that has to go and talk to them and tell them and discuss it with them and all the rest of it. So there is some issues there because they have managed to miss some key workers, because I can tell you now, if we go down because of quarantine, let alone catching it, there would be a huge impact on the operational ability of the hospital at night. So parts of it have been done really well and parts of it haven't been done well. Kitty's experience was very slick, very focused, and worked very well. Other than the fact she had to get up after nights and drive to downtown Toronto to get it done, instead of just having an appointment at Newmarket, because it's not provincial, it's hospital. And that's kind of a ball drop there. With something on this scale, you need to have an overarching push to get nursing homes and outbreak places and nurses and RTs and doctors and porters and cleaners looking after these people who have the disease already. You need to get them done really quick. And it would have been better to do it as a provincial thing rather than per hospital, in my opinion, but it's too late for that. Now, Kitty's parents are actually in assisted living, and don't feel too sorry for them. It's a really nice assisted living. They're still pretty healthy and mobile, and they're actually going to be vaccinated before me.
Yeah, I don't think they've really considered the impact if your office goes down on the running of the hospital, that you guys should be vaccinated for sure. And it's not even hugely impactful. There's just a handful of you. It would be very easy to do, so they really should, because if you guys get an outbreak, let's say 4 of you are down, the impact's going to be huge. So I would like to see you get vaccinated too. Yes, I spoke to my dad today. He said they are scheduled to be vaccinated on the 14th. So very good, very good, very good. They'll do it in-house. They won't make them go out for it. And yeah, I told him then when we get the second vaccine, and then a few weeks later, we'd have him over for dinner with Wolfie. I think he's more excited to see Wolfie than to see us.
Yeah, I think so. And I should give him some scotch. Now, whereabouts in your arm were you injected, and what type of vaccine did you get?
Pfizer, biotech.
Were you injected correctly? Yeah. Who did it?
An older nurse.
Nurse, right. And hopefully that's what I will get. I want a nurse to inject me, not some trained doctor who's never given injections before.
The only people I saw injecting were nurses and paramedics.
Yeah, I believe we've switched to that, at least in our
I
hospital.
think they have to have a doctor around.
In case you die, yeah.
Well, because of the allergic reaction.
Yeah.
But I didn't see any doctors doing injections.
No. Cool. How long was the lineup?
They had multiple stations, 12 stations maybe. And they book appointments. So there was a person ahead of me, but we just flowed through. So there was essentially no line.
Right. And
when I got there, when I left, there was a little bit of a lineup.
Right, end of day, right?
Yeah. End of day shift, people were doing 8-hour days. But when I got there, nothing.
Yeah.
I mean, they were moving us through. There were people getting vaccinated. The stations were going one person to the next, but I just flowed right in.
Did you have a chocolate bar at the end of it?
No.
Did you get a drink?
No.
Did you get a sticker?
I have a little package. I left it in the car.
Oh, okay.
Sorry.
So it wasn't that impactful for you then?
Well, it's a little package about the vaccine, the side effects, and probably some certificate saying it.
I think you should get a sticker.
Maybe there's a sticker in there. I had a sticker past the hospital sticker.
I'll have to look.
That was it.
Well, that's it from us. Good on Kitty. In about 6 to 7 weeks from now, Kitty should be about 95 or higher, protected against COVID-19, which will be a huge relief because most of my exposure risk is actually from Kitty because of what she does. So I'll be very happy with that. And her parents will be about 8 to 9 weeks from now. And that's good news. And whenever I get vaccinated, I will video the whole thing. Anyway, that's all from me. If you like this, please subscribe, give me a thumbs up, and if you don't like it, give me a thumbs down, unsubscribe me, and never darken my channel again. Toodles!
Toodles.
Toodles!
You're waking him up.
This was a very, very sleepy Wolfie production 2021.